Welcome back to the Curbsiders. I'm Dr. Matthew Frank Watto, here with my great friend and America's primary care physician, Dr. Paul Nelson Williams. Hey, Paul.
Hey, Matt. How are you?
You know, I feel a little slighted, but we'll get through it. You didn't like the puns. You didn't like the puns.
Famously humorless like that. This is all on me.
All right, so we have a great episode to recap, number 458, heart failure with reduced ejection fraction, or HFrEF, as Paul likes to call it, with Dr. Michelle Kittleson, returning guest, and production by Dr. Deb Gorth and infographic by Zoya Sarani. So, Paul, let's start off with when we find someone with heart failure, what's the most important question to ask ourselves first?
It would be great to know why this person has heart failure, Matt.
Yes.
So, because that may actually guide some of the treatment that you actually provide for the patient. So if you know why it happened, that actually may impact some of the therapies that you have to offer someone. So if someone has a new cardiomyopathy, some of the times it's obvious, some of the times it's less obvious. So is it worth, case-by-case basis, obviously you're not going to do the $1 million click all the button workup for every single patient, but is there family history? Is there reason to suspect iron overload? Do they have underlying thyroid disease? Is there a history of heavy alcohol use? Or could it be amyloid? Are they giving you a great history of bilateral carpal tunnel and they have heart failure? And on and on and on. So it's worth actually thinking about why the heart failure is there first. And then you can go buck wild with your guideline-directed medical therapy, but that may actually change a little bit in terms of how you work it up and what things you do next.
And everyone always likes to ask about BNP, and we talked about this with Dr. Kittleson again. So she said it is a great thing that you can check if you're trying to make the initial diagnosis. It can be helpful in that setting. As far as once you know someone has heart failure, when someone's being admitted to the hospital, if the BNP is above 5,000, that can be a poor prognosticator. So it does have prognostic value, but as far as trending the BNP over time and using it to make